welcome to this episode of the Shaking Up the Vet Industry podcast. And today I am really delighted to be interviewing Charlotte Speller, who is a veterinary physiotherapist who runs her own company, Lead the Way Physio. So welcome, Charlotte. Thank you ever so much for joining me today.
You are most welcome.
Thank you.
I'm more than happy to be here.
Yes, we've had some nice chats, haven't we? So there's a lot that we could be sharing, but we're just going to kind of use this one today as kind of a lead in, really, to allow sort of introduce really the world of veterinary physiotherapy to people that are going to be watching. But don't be surprised if we record another one, everybody, because there was so much that we could talk about. But we're having to narrow it down just to pop it into an hour, really, aren't we? So. Okay, so obviously the first thing that I think, quite a lot of people are going to be asking is what is veterinary physiotherapy?
So veterinary physiotherapy is basically it's a multi-modal practice. So we use techniques such as massage, we use EPA equipment, so that can be things from laser to PEMF, which is pulse electromagnetic field therapy. Very big breath there. We use ultrasound therapy, shockwave therapy, radio frequency therapy. That all kind of comes into the bracket of EPA treatments, and also as well physical exercise as well. So if you think of it, it's a physical modality. We are very hands-on, and that's how I like to practice. It's all multimodal because they have different effects on different parts of the body and they all work better together, not just on their own. So that's how I work, really.
Okay, that makes sense. And just for those who aren't in the know, what does EPA stand for when you said that?
So they are electrophysical agents. So they are it basically comes under the ballpark of laser will come under that. So if anyone's heard of laser therapy, that comes under EPA treatments. Ultrasound therapy does as well, radio frequency, pulse electromagnetic field therapy, and all of that comes under that electrophysical agent bracket.
Okay. And do you do things like, obviously you've said about exercise and massage, do you do things like kind of the physical manipulation? That might not be obviously the way you word it, but that's what is coming to my mind.
I've been trained in joint mobilization techniques. Now, I don't use big techniques like most chiropractors or osteopaths use. That's a different sort of practice. But what we aim to do is basically get a joint moving the way it's supposed to be moving if we can. Obviously, there are reasons why we wouldn't do it. That is a whole, it's us during our clinical rationale really to look at what we're working with and how we actually do it and whether or not we use that technique for that specific patient. So I'm trained in joint mobilization. Some physios may not be, but that I'm trained in that.
Okay, lovely, thank you. Yeah, no, that makes total sense. It's working, as you say, with each individual patient, the conditions, the symptoms they have, what's going to be best for them, obviously, in their rehabilitation, in their treatment plan. So you're working, obviously, ethically and safely, obviously, to help them the best way you can. So when is physiotherapy beneficial for pets? So what kind of things would we be sort of thinking of here?
So everyone probably knows physical physiotherapy, especially in human world. It's normally sort of your post rehabilitation after surgery, so orthopedic surgeries. So that can be anything like cruciate ligament surgeries to elbow surgeries, all of those kind of orthopedic surgeries, and also your neurological conditions, so things like your spinal YVDDs, spinal cysts, compression, spondylosis, all of those sort of neuropathic problems we help with. But also it's, for me, I look at a lot of prevention. I think physiotherapy in its whole entirety and bits of the modality can be used throughout that pet's life, if I'm honest. So we don't need to wait for a problem to arise. You also have dogs for conservative management of things like hip dysplasia, patella luxations, things like that. But those are all sort of your ballpark around that sort of bracket. But I personally feel like physiotherapy really benefits dogs throughout, from puppy stage all the way to senior years, really.
Yeah. No, absolutely. I mean, if you think about the times that, I've certainly had physiotherapy for me, and that's not necessarily been due to a condition. It's more been due to like an injury, for instance. So I had a weak rotator cuff, so I needed physiotherapy for that. I lost the use of my left hand, so I needed physio for that.
Yeah,
You know, so sometimes it can be accidents and injuries that trigger
of course.
something that actually you know, yes, might need veterinary assistance with, you know, various things like obviously them assessing it first and so on. But the physio could be obviously what's then needed more than anything to actually then help that patient move forwards with that little niggle or that condition. Because there's also that obviously the situation where if that's left, a bit like with us, if something's left out of alignment, of
Hmm.
course other parts of the body compensate, don't they? And I
Yes,
know
of
when we
course.
had our chat, you know, you were saying about that you often see those patterns where when, you know, say the right hind has been compensating, then some other part of the body is then compensating in a different way because it's having to try and support the weakness in the right hind or whatever. So would I be right in saying that? Because I
Yes.
don't want to put
Yeah,
words
of
in your mouth.
course. I mean, the thing is, when something goes wrong in your body, regardless of what it is, your body is a complete system. It's made up of completely different systems, but your body is an entire and is a whole. So if your right leg isn't working properly, your left leg is going to be taking up the slack of why that right leg isn't working as well as it should be. And on a dog, we tend to find if your, let's say, your right hind isn't working properly, then your left fore and your left hind will be compensating for that disuse of that limb. So basically you shift the weight around to try and make yourself functional. Your body is an amazing piece of itself to actually try and enable you to function. And sometimes what happens then is because you've been functioning in a certain way for so long, eventually the overstrain on that part of your body where it's been taking up the slack from the weak part, that's the one that has ends up with the problem. And so when I see patients, especially with dogs, they come in with a forelimb lameness, I can track that back for the most part to a hind limb weakness. And it's that compensation from where you've been putting more weight on that limb that actually it's supposed to be taking. Because if you think of a dog, they should have 60% of their weight at the front and 40 at the back. If you're taking, even 65% at the front, that's 5% more than what you should be.
Yeah.
And actually, that 5%, if you're not strong enough to actually take that, eventually the tissues do take the flak for that. So you can end up with compensatory injury. So
Okay, great.
it's,
Thank you for explaining that because I know I certainly in my world I've heard it from, you know, sort of canine masseuse, you know, individuals and that kind of thing anyway, but I just definitely wanted to get your take on it. And do you tend to, because a word that popped into my head, do you tend to see quite a few patients with like arthritis?
yes, yes.
Okay.
Yeah, arthritis. And we often think of arthritis as being something that old dogs have. And actually, it's surprising how young some of the dogs I see with arthritic changes. Now, that's not to say that it's necessarily causing a problem. Over time, wear and tear does happen. But when you've got a condition such as hip dysplasia, for example, now
Yeah.
those hips have been developing badly since they were very, very young. So all puppies are born with really good hips, and it's that development that actually changes how the hip is developing, and you don't get proper development of those hip joints. And then what that does is then that causes microfractures within that hip joint, which then cause the arthritic changes. So a lot of the dogs I see can sometimes be 3, 4 with already arthritis into the hips. So we don't, it's it's so often thought as just an old dog condition. And actually it's sometimes normalized that, oh, they're just getting a bit old, oh, they're going to be a bit arthritic. And actually, you know, yes, there's going to be wear and tear as we get older. That's just, life, unfortunately.
Yeah, exactly. Part of the
But
game.
pain doesn't have to be normal. It definitely doesn't. So there, it's not normal for your dog to be in pain when it's older. It's not normal to do it. It's common, but it's not normal. So that I try and have that differentiation of common things to
Yeah.
what is actually normal.
Okay.
So
Lovely, thank you. And I know sort of, you know, senior pets is quite a big topic in itself, and we're not going to
mm,
kind of dive into that today. We might do that perhaps on another podcast because I feel again that would be really helpful for people to know a little bit more
oh, of course.
how they can definitely help them. So like apart from obviously we've been saying about like arthritis, what would you say are the most common conditions you tend to work with?
So hip dysplasia, It's
Okay.
very, very common. And it's actually common amongst a lot of different breeds you wouldn't even think about. So everyone, when you say hip dysplasia, you normally think of your Labradors and your German Shepherds, for example. But in a study I've currently got running, we've had Cockapoos, Border Collies, Pointers. You know, it's been a very mixed bag in terms of these dogs that have been diagnosed with hip dysplasia. So hip dysplasia is quite a big one. Cruciate ligament ruptures, so that's always a bane of my life, having CCLs, just because again it's so common and it's so tricky to actually really rehab and rehab it well. So again, you can think of your Labradors with that, your Boxers, any, you know, any sort of, you know, larger bouncy breed, but it can also happen in smaller dogs as well. So don't rule it out just because you think my dog's small, it's not going to get a cruciate rupture. It can happen, and it's for a variety of different reasons it can happen. In some of your smaller dogs, patella luxation is another one that I see quite commonly. Elbow dysplasia, you know, because I see it, it's common for me to see it, and it's more common in some breeds, but just remember your dog, if your dog has a knee, which they all do, something can go wrong with the knee. If your dog has a hip, it can have something wrong with the hip. So it's always just being aware that actually, you know, it can happen across the board, across any sort of breed of dog, really.
And not just dogs. I mean, I know obviously do you work with horses and dogs or just dogs?
I'm solely dogs.
Okay.
I did train with horses. I decided it wasn't for me.
Okay.
I do not
That's a whole
ride.
podcast in itself, I think.
And I just feel because of my background in dog behavior, I've been working with them for so long, that's pretty much where my forte lies. And so dogs are my primary patients. I can work with cats, you know, they're not the most how can I put it, cooperative of patients some of the time, but cats do need physio as well. You know,
Yeah.
I think I read somewhere about 90% of senior cats are actually in pain, and it's not seen as something you tend to do with cats as much as what you do with dogs, and you know, as well as what you do with horses. So if you think of it, how physiotherapy developed, it come from humans, then it went on to horses, because let's face it, you've got the racing industry and a lot of horse sports that are actually keeping your horse very fit. It's beneficial to what your industry is. So then it stemmed into horses, then it went down into dogs, because again, you've got a lot more dog sports. But actually, if it's got muscles and it's got bones, any animal can have physio. So
Yeah. And I know certainly, you know, personal use, you know, we found out in the latter phases of her life that she had a previous cruciate rupture,
mhm,
which hadn't, for whatever reason we don't understand, before she was taken on for the charity that fostered her, that she'd had that rupture, but that was never highlighted to them
mm,
at all, bless them. And it was already healing by the time she came to me.
mm,
But it was only in her latter years that actually veterinary diplomat actually turned around and said, yes, that has actually happened previously.
mm.
And so, and I know with her, she probably would not have been cooperative with physiotherapy.
Yeah,
But as you say, it depends on the cat, it depends on their demeanour, and you know, obviously what the condition is and what's going on. So it's not, as you say, just dogs, but obviously most of this podcast will be about dogs.
yeah,
But yeah, I just wanted to sort of highlight that absolutely other species can definitely get, you know, the cruciate ruptures. And she had, I mean, bless her, she had hip dysplasia, she had the arthritis in both hind legs, she had, as we know now, obviously the cruciate historic cruciate rupture, as I would call it. She had the current cruciate rupture, which then obviously with everything, all of that going on, and spinal stenosis, sadly, that's why we all of us together had to make the decision
yeah.
about obviously her, you know, being put to sleep, sadly. But it doesn't always end that way. Certainly when I was in veterinary referrals, we used to see a lot of dogs coming in for, you know, cruciate ruptures and having TPLO or TPLO treatments,
Mhm.
TPO treatment, sorry. And so yeah, it was quite a common condition that we used to see quite a lot.
Yeah.
Well, not me personally, so I'm not the
Yeah,
specialist.
it
But
it
yeah,
is it is an annoyingly common condition. I had to rehab my previous boxer from TPLO surgery when he was 18 months old. So, you know, it can happen quite early. And normally when I see CCL ruptures, yes, it can happen in older dogs, but it's normally around that adolescent bracket where basically their development, they're big and they're bouncy, but their muscles haven't really caught up with the way their bones have actually started to grow. Your muscles haven't matured properly yet, and they're bouncing around, and then the ligament takes the strain, and then eventually, you know, the ligament ruptures or has a partial rupture. But either way, it's still a weakness and a compromise in that ligament. So
yeah.
it's, you know, there are things we can do to prevent things, but, you know, accidents and things do happen. And I know there's a lot of studies going on in the background as to why cruciate ligaments are such a problem in certain breeds, whether or not there's a genetic element, but that's another story
Mhm.
for another day.
Yeah. And what would you say, like, if we took like the orthopedic procedures that we've sort of generally been talking about, what would you say are the benefits of having like a physiotherapy rehabilitation plan for those kind of patients? So whether that's hip dysplasia, elbow dysplasia, the cruciate ruptures we've been talking about, those kind of things. What are the benefits of having a physio on board with obviously the treatment plan?
Well, for me, if you know, when you're looking at vet procedures, so if you're looking at, let's say, I'm just going to take a TPLO example, because it's so your dog will have TPLO surgery, so that involves putting plates and pins into the bone, so that replaces the need for the ligament, so that's basically stabilizes the joint, so the ligament is no longer needed to do that. You have metal plating in place. But what I normally see is we get the, oh, you know, 12 weeks and that'll be healed. And in theory, yes, it will be because your bone will have healed in 12 weeks. But that's only taken into account the bone healing.
Yeah.
That's not taken into account the pressure on the opposite cruciate ligament. So if you've had your left knee done, that might have been deteriorating for quite a while. So actually, your right CCL has been taking a bit more pressure than what your left one has because the dog's actually shifted its weight, or the cat, or, you know, whoever. If you think of as a person, it's your ACL. So that is also now compromised because that will become weaker. You might have micro tearing within that CCL ligament. So that 12 weeks doesn't take that into account. It also doesn't take into account the muscle wastage that would have happened. So as you don't use a limb, so if anyone's had a broken arm and have had it in a cast for a while, you see that muscle difference when you take that cast off and how much wastage is there from where you haven't been using that limb. So it doesn't take into account that muscle wastage. It doesn't take into account the compensatory pads on the forelimbs, for example, and even on the ankle joints. So if your knee's compromised, your ankle joints, so your Achilles tendons and things like that, again, are taking more pressure. So you can get, I know after my boxer had TPLO, he ended up with a slight Achilles problem and a slight swelling on the
Okay.
Achilles, just because of that extra pressure that's being put on that joint. Luckily enough, that wasn't a surgical intervention. We got that bottomed out, but you know, it's pressure on the whole body. So that 12 weeks is solely based on the fact that the bone is healing within that 12 weeks, not on every part of that body. And you can get complications with surgeries as well. You can get meniscal injury with cruciate rupture, just of the way the biomechanics of the meniscus works when you have compromising the ligament. So you can get meniscal injury, and actually your risk of arthritis in that joint, when you've put a lot of metal work in there, is actually increased as well. So you
Okay.
want to make sure you're rehabbing your dog. And with my CCL patients, I kind of see it, the slower the better is my personal thing. Take your rehab slower rather than aiming to have your dog off the lead in 12 weeks, because I have never seen a professional footballer with an ACL injury, with all the rehab they get, and they get a lot because they're paid a lot of money and they're worth a lot to the club, they're never back on the pitch within 12 weeks. Never. So, you know, if you think of it like that, it takes a lot longer to heal
Yeah.
that. with things like hip dysplasia, because normally, unless it's quite severe, surgery normally isn't the preferred thing to manage that. It's normally conservative management. Again, you're thinking of how can you make that dog stronger, so actually you're protecting that hip joint a lot more. You're protecting the rest of the body. You're stopping, again, if your hips are not working properly, you can get CCL rupture because you're putting more pressure onto the knees, problems with the ankle joints. So it's a lifelong condition you are managing. Physiotherapy isn't going to change the underlying anatomy of that condition, but what we can do is make the dog stronger, better, so they're able to have a more normal life and actually keep that quality of life going on to their later years if we manage that condition well. So we don't have to get so much arthritis into that joint, as if it wasn't managed very well, then what happens is the weight's all pushed forward, and again you can have that problem in the elbow and in the shoulder from that. So it's basically with hip dysplasia, because I don't normally see a lot of surgical intervention, but obviously it does happen, but it normally doesn't, it's not normally preferred from what I've seen veterinary wise. They don't normally want to operate unless it's very, very severe for that condition, just by the nature of how big these operations are.
Yeah.
So they prefer to have it managed and managed well. So that's for like the hip dysplasia ones. Then you've got all the neurological ones as well. So basically, if you're thinking of if your dog's had surgery, or even if it's got a condition it doesn't need surgery for, you're looking at managing the condition. The condition's not going to go away. So that's more of a management, whereas post rehab you're rehabilitating after an injury. So that's my take on things. Sorry if it's a bit long-winded, but
No, that's fine. It just gives people an idea, if their pet is either perhaps due for a surgery that we might even be talking about, or has had surgery, and maybe they're seeing that they're struggling a little bit, and it's been a while since the surgery's happened and the healing's happened. It just allows them, again, the reason I'm recording these is it empowering pet owners to have, it's not even just more freedom of choice, it's just giving them other options that can support or work alongside veterinary medicine.
Yes,
And this
exactly.
again is it's amazing how you kind of came into my life, obviously, with what was going on with Puss. And then I was like, oh, I need to interview you for the podcast, because veterinary physiotherapy is one that I did want to cover, because I think as I say, it empowers people that if somebody says, right, your dog has, ruptured his cruciate, he's going to need surgery, then there can be that kind of discussion of, okay, so if they have surgery, what's going to happen afterwards, and how do we get them moving back towards, obviously, optimum health. Doesn't necessarily mean it's going to be the health they had prior to that happening, but optimum health for them at that stage of life, and obviously what's gone on with their body. So I think it is important that they have these explanations so that they can actually go, oh yeah, actually I can feel things resonating with me. I want to ask my vet about that. So so yeah, don't worry about the longer explanations. It's not a problem, not a problem. And I mean, in some ways, my next question was going to be, does it work alongside veterinary medicine? I think to a certain point, you've kind of answered that, really, that yes, it can work very well post-surgery to have that rehabilitation plan. Obviously, the vet's doing what they need to do with that condition and that surgery process, and like revisits and checkups and everything, and x-rays probably as well. But then you can come into it with obviously then moving that pet forwards, or in your case, moving the dogs forwards, to allow them to get back towards obviously the optimum health for them at that point. So
exactly. And the thing is, because we have to, all of my patients come under vet consented treatment, unless that, in 2020 that did change, that I can see a fit and healthy dog with no lameness, no prior pathology or anything like that without vet consent, but the dog must be registered at a vet. If I spot anything that I go, that's not right, I have to cease all treatment and send it to the vet for referral, and or for diagnosis. I legally cannot diagnose anything. So it all works. We're not here to be a replacement for vets. We work alongside them, and actually we kind of do the things that I think probably sometimes vets wish they could, in terms of advising those owners. You know, if you've got 10 minutes with the vet, they don't have necessarily the time to say to you about home adaptations that can help your dog, weight management, you know, all of those sorts of things. You know, we're here to support them in basically having your dog as optimal health as we possibly can do. And also as well, the vets come into it, sometimes dogs do need pain relief. You know, if I'm working on a dog who's so painful and I can't touch them and I can't do anything with them, actually, it's not ethical for them not to have some pain relief. And actually, then that will allow me to then work with the dog on the repair of the tissue whilst they're more comfortable. And then at whatever point you can speak to the vet and go, does my dog still need this medication or does it not? Can medication be reduced? But that's all a conversation to have with the vet. You know, in some cases I've seen, I have said, you know, I think you need to talk to your vet about pain relief, whereas they haven't prescribed that beforehand. But I said it might be a conversation you need to have. Or sometimes you know, as the dog improves or as your animal improves, if it's a horse, cat, dog, fish. I haven't done physio on a fish. I don't know whether that's possible, but hey ho. But you know, you get the idea.
Yeah.
It's
Yeah.
more, you know, it's then as they're getting better, can we reduce the amount of medication now they're on? Do they need that medication like they did right at the beginning? So again, it's all about having that rapport with the vet and actually just empowering owners to ask the question. You know, whatever my opinion is, I cannot and will not overrule a vet in what they decide to do. That is completely down to them. They are the primary source of care for your dogs, but we are basically that secondary point of how we can rehabilitate that dog and get your dog to basically as fit and as healthy as it possibly can be by providing support alongside what the vet is doing.
Yeah. And certainly you said at the beginning, obviously, because it was pretty much the next question I was going to ask was obviously, does somebody need a referral from their vet? So again, you've kind of answered that question in that actually, if the dog is fit and healthy and is showing no signs of anything, you know, then obviously you can see them without veterinary consent. But if there is something going on with them, they do need to go and speak to the vet and say, I'd like my, you know, dog to have some veterinary physiotherapy. Do you think it would help? I'd like to see Charlotte or whoever might be in their area. Please, could you do a referral form, you know, and send the history over and x-rays and so on. And that is the whole thing, you know, that we're talking about here. It's not about isolating your vets from this other, you know, caregiver or modality. It is about working alongside. And I think we had this chat before that, you know, you will send your reports over to vets so they've got, you know, obviously the information that they need, because again, it's all about not, you know, you don't want any contraindications. You don't want the vets trying to do something that and you're doing something else. And, you know, so it is all about keeping the relationship with someone's vet, but also knowing when there's that moment to kind of go, right, okay, if they're having surgery or they've got this particular condition, you know, hip dysplasia, if we're not going to do surgery, would physio help? You know?
Exactly. It's, and also as well, even when I'm seeing my patients and I have that full vet consent, if something's not going the way I kind of expect it to, if what I'm doing isn't working, there could be something underlying that hasn't been picked up on yet. So, you know, you can have endocrine problems like Cushing's disease, Addison's disease, things like that, that may not have ever been picked up on before, but actually they will all affect how your muscle develops and things like that as well. But also I had a case that come to me for a CCL rupture, and that was going to be managed conservatively. So I started treating, but actually I started to spot some neurological symptoms in this dog. So I said, look, I need to speak to your vet. And so I sent them some videos of what I was seeing, what was there, and said, what do you think? This is what I've measured. What would be your approach now? And that's up to the vet as to how they want to approach it. They might want me to stop treatment and actually say, you know, again, that's again liaising with the owner, whether or not more imagery needs doing or whatever. In the case that I had, you know, the vet said it's absolutely fine for me to continue. There was other circumstances involved, and actually what I was doing was not going to cause any harm or hiding of what could possibly be underlying there. So it was agreed that I could continue to treat, so that's absolutely fine. But it's keeping the vets in the loop as well, because you know, I might spot something that they might not have done, and that's not through any fault of their own. I see a dog in that hour and a half session. I only see it for that hour and a half session. As an owner, you will see that dog all day, every day. And some of the problems can be intermittent. So they will say to me, oh, it doesn't always do that. So it might not do that in front of me. And
Yeah,
in which
or the
case,
vet.
then yeah, or the vet, it won't, or you've got a dog who goes, oh my God, I'm at the vet's and they don't move around as much or they don't do
Yeah.
things as much. So I go, send me a video. When it happens, get it on video, show it to me. And actually, if you're going to the vet with a problem, take some videos, show them before you see them, show them beforehand, send it over to them and get them to look at it before you see them. Make the most of that 10 minutes you've got by giving them something beforehand. Because if your dog walks in and goes, actually, I'm all right today, then the vet will be quite confused as to what you're saying to them. So, because they're not seeing what you are. So, do some videos, get that all over to the vet beforehand or to me, if they are seeing me, then I go, oh, okay. So it has done that. Okay, this could be the reason why, and blah 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 blah. But it's all looking. We only get to see a snapshot of what we're seeing at that period in time, and that might be not the full picture of what's actually going on.
And I think that's an amazing tip to give pet owners, is for any condition where having a photo or having a video would be really useful, like just do it and get it sent over to them. Personally, I think most of them would be, really happy that you're being really proactive. It
Yeah.
really helps them. I mean, certainly working in vet referrals, I remember our cardiologist seeing a dog who obviously from the history they felt that it could be a heart issue, but it was actually that the dog was presenting with a cough of some description. And one of the things they said to the owners was, could you video when it happens, because it didn't happen all the time. So the things is that also when you're taking a video, you might start to see a pattern. Oh, do you know what, it's always in the morning I've been taking this video, that's interesting. And it'll be things that you don't even think about, and suddenly if you turn around to the vet and saying, well, it's always in the morning, it's always when we've been for a walk in this meadow, or in the rapeseed fields, or like suddenly you're like, okay, could the rapeseed field have something to do with it? So it can sometimes bring things to an owner's awareness, but also could be really useful for a vet. And actually, like I've been it's a slight digress, but it's also linked, is I've been studying and working with homeopathy with myself for about a year now, and having sessions here and there when I can do it. And I know when they ask about remedies, they ask for the most detailed information. Is it worse when you're sitting down or standing up? Do you have sensitivity to light or heat, or and it just made me kind of think of that, is it's those little nuances that actually can, again, with your vet, give them information. Because if you say to them like it only happens in the morning, then they're going to already be thinking about that, right? Okay, so is it because they've been stiff overnight? Is there something going on in the house around that time? Or if they only happens after a walk, naturally they're going to probably be asking you, where do you walk your dog, what's around that area, and that kind of thing. So
how long were you out for, and actually, because you've got differences in presentation of things. So normally if I see a dog that's stiffer in the morning but then they loosen up after exercise, I kind of have an indication of what that could possibly be going on. Whereas if I've got a dog who goes lame straight after exercise and it, whereas they're fine beforehand, again, it leads me to think there's another type of condition going on. So it can be really beneficial just to make note, especially because ultimately you guys as an owner will know your dog better than we do. And if you're seeing something and you're going, this just isn't right, this just isn't right. And we often don't see the same vet anymore, the same way as we don't see our own GP anymore. I've got no idea who my GP is anymore. I remember my old GP that I had when I was little because we saw the same one, but we don't have that anymore. So when you're trying to basically convey to someone who's never met your dog, never met you, doesn't know who you are, doesn't know your dog, you're saying this isn't normal for my dog. Well, they don't know what is normal for your dog. They have no idea. So try and give them as much information as you can, because then you will get a better result from the vet, and not go away feeling, you know, because sometimes, you know, again, with people with GPs, for example, can sometimes feel that they haven't been heard or they haven't been listened to. And actually, sometimes it's a complete, they don't know what is normal. So they're kind of going on a partial bit of information and leading down to that road. And actually, then that leads the owners to feel very frustrated. And actually, then they don't want to see the vet anymore. And then that can actually become a bit of a welfare problem in that regard, because you can put something off so much. And actually, you know, we could have got the problem solved much earlier, if that makes sense. But it's gather as much information. If you're seeing certain issues, keep a diary of it. And actually, the more you can kind of, the more you know your dog or your pet or your cat or your horse, the more detail you give them, the better the outcome you will get. So that's just one of my top tips of what you can do if you think there's something going on that you're not quite sure about.
I really like that, to be honest, you know, because as I say, as soon as you said it before, I was like, absolutely, you know, I mean, I'm in a situation, not actually with my own cat at the moment, but there's somebody around me, and we are providing photos to the vet, you know, for this particular situation, so that they can actually see, obviously, the progression of something. So again, obviously, that way we're communicating with them and we're saying, right, okay, you're asking for photos, so we're going to send you photos over, because that way you can make, obviously, the most accurate either diagnoses or decision, if you like, you know, based on that photo compared to the last one and so on. But yeah, definitely videos for anything, you know, that actually would be beneficial, as you say, with, you know, joints, with coughs, with anything where a still photo is not really going to cut it, you know, like
Yeah,
you
exactly.
can't show a dog's stiffness on a photo. It's just not going to work. So do the video, get it over to them. And I love the idea of a diary again. And it's funny, as a therapist, not funny, but as a therapist, it's similar to what I would say with, you know, people with habits and things like that. We get them to do like a mood and food diary. Now, obviously, you're not going to do
Yeah.
that with a dog, but you know, you get them to do things like that, so they start to see, right, when do you crave that particular thing most, you know, okay, what's going on around that time and so on. So it's all, you know, common sense in a way, but I think it's things that, I mean, we certainly did used to do it in referrals, but I've never, apart from this most recent situation, I've never been in one where somebody suggested that to me. So I think it is important to do that, because again, as owners, sometimes when your pet does something, you might describe it in a certain way based on your observations and what you feel
Yeah.
or you think. And certainly when I've been working with people and you know, with pets and their owners, even with what I work with, which is not clinical, but sometimes somebody will say, you know, oh, I think they were just excited. And then, you know, they've sent me a video because I've asked for a video. And I'm like, oh, no, actually, I think there's something else going on here. Because did you notice when they, you know, came around the corner, like they looked at something in particular, or they stopped for a moment, you know? So there's certain things that you know, as a trained professional, but whether you're veterinary physiotherapist, you know, that you're going to spot that perhaps an owner won't spot,
Yeah.
you know, because they'll be just looking at the video because this is a pet they see all the time. Whereas because this is like your first view of it, it's like golden nuggets, isn't it? You'll just see that one moment where you're like, oh, there. And it
Yeah.
could be really subtle. Like I when I fostered Panda, he was a 20-year-old domestic shorthair cat. And with him, like I mean, he was 20, bless him. So yes, he did have a few things going on. But one of the things was literally he used to get up onto my lap and put his forelegs on my chest. And it was just one morning when he did that, it was he went to stretch up and it was just like, oh, you know, and it was so subtle that had I not really been like observing him, we wouldn't have noticed, you know. It would have just gone by. But because I did, I was able to speak to the charity that obviously I was fostering him for, and straight away it was like we dealt with that situation. He had obviously support for management of arthritis. You know, he was already on that, but obviously it got upped because of that and so on. So that's the thing. It can be sometimes very subtle things that we won't always notice as an owner, that yourselves and the vets will notice on a video, you know, that can actually then help them with their assessment. So right, we're going to come away from that because I think we've done that to death. Okay, but yeah, we're just kind of saying, guys, you know, take the videos, take photos, do diaries, really good idea. And it can also help you gain awareness as much as your vet or a vet physio. So
Exactly.
for a first consult, because I appreciate every consult is going to be different based on the
Mhm.
pet's condition, age, health, etc., symptoms. But generally for you, what does a first consult look like? And
So
I was just going to say the other thing, what does it look like, and what can an owner expect in that session?
So during my initial consults, so I normally take a little bit more time because I'm getting to know the dog and getting to know what bits and pieces are actually happening, how everything's fitting together. So I will start off by just obviously meeting, looking at the dog, how it's just moving around naturally before I ask it to do anything, seeing how that dog's sitting or laying down, whatever position they're in, just because I'm mobile, so I see the dog more or less when in its own home. So I can watch how the dog's moving in its own environment. I also can look around and I can see the home environment for, as it is. Are they struggling in the kitchen, for example, whereas they don't struggle in the living room?
Yeah.
So is the floor surface a problem? Is this a problem? All of those sort of things. So I spend like a few moments, just observing, just as I'm talking to the owner about bits and pieces as well. So then normally I ask for a bit of gait analysis, so I can either do that subjectively, where I just use my eyes, or I have got a bit of equipment, I can use more objective measurements to do that.
What do you mean
And
by gait analysis, just for those that don't know?
watching the dog move. So I normally want to see them in like walk and trot, and I ask them to do a sit to stand as well. But I also observe the dog when they do that naturally, because sometimes when I ask a dog for a sit to stand, compared to how they naturally want to relax in a sit, is very different posture wise to them. And I'm also asking the owners different questions. How do they prefer to sleep? Where do they sleep? Where is other struggles? I might watch them go up a few little steps if I can see that that's an issue. But I can, it's all quite subjective in that regard of what I see with that patient, what is going on. But normally I spend a few moments getting to see the dog moving around, seeing how they stand, how are they standing, how are they loading themselves, then how they're moving. So what's their movement pattern like? So that's in walk and trot. Obviously, if I've got dogs who can't actually trot, if the owner says to me it's when they're running, I normally ask for videos beforehand, because I don't normally have an area that I can actually get them running around in. And actually, if I think they've done a mischief, it's probably not advisable I make them run, if I'm
Yes.
honest. But I get the owner to video that for me beforehand. So sometimes I've got some intel before I go and see them. And then what I also do then is I do a full palpation of the dog, so I feel their muscles, I feel their range of motion, and basically what I'm feeling for then is symmetry. So is something bigger on one side, So it's a bit more detailed than what I'm saying, because I go into particular
Yeah.
muscles and things like that. But as a ballpark, is something bigger on one side? That would tell me that's working harder. As I go down, am I feeling any knots in the tissues and things like that? And I normally try and treat as I kind of go along a little bit as well, because if I'm finding knots and trigger points in the dog, the more I sit there and test for it, the more discomfort, because it is uncomfortable finding a knot in the tissue. It's not very
Yeah.
nice. But I try and go, haha, it's there. Okay, I'll start doing some treatment there. I can either put my EPA across it while I'm just fiddling around with the other bits and pieces on the dog. So, and then I test for range of motion in the joints. If there's any special tests that I think that need doing, so these are special orthopedic tests that I've been taught, then I will conduct them and make notes of them as well. And so, yeah, that's basically how my consult goes. Then what I do is, depending again on how severe everything is, how acute or chronic, or whatever I've found and what that patient needs, I go through some exercises. So those exercises are tailored to your dog. So what exercise you can do, these can be, as simple as range of motion exercises, or static exercises, to what a lot of people think we do is basically sit to stands and pole work and things like that. So it's all of those sort of in a bag. So that's normally how I conduct my sessions. And then any follow-ups, I kind of see how they're getting along with those exercises, and I'm assessing again for how that is different to the first one. Is that going the way I want it to? Are we getting more discomfort, less discomfort? Where are we going with this? So I kind of know by that point where the pinch points are on that dog. Obviously, if the owner said to me there's something new happening, then I investigate a lot further. But it's all round about that sort of ballpark. If I've got neurological dogs who can't walk, obviously gait analysis is not entirely possible.
No.
But I will look at how is the dog unable to stand? Can I get it to stand up for a certain period of time with support, obviously, and what it is to go along, and basically as I'm going along what treatments I find. So my primary concern is addressing any pain related issues. And then I move on to range of motion. So is range of motion compensating in any way? So how can I improve that range of motion in the joint? Any compensations that are going on in that dog. So again, like I said, left hind, right, left hind, right fore, all of that sort of jazz going along. Then we move on to functional movement and strength. So how to get the dog moving more functionally, and then how to get them stronger. So those work quite in parallel together. If I've got a neurological dog, then obviously my proprioception and my reflexes will come into par of those as well. So on most of my dogs, I normally flick the feet over and just check for their proprioception anyway, just because I just think it's always beneficial. If there's nothing wrong with proprioception, that's fine. If I do find something, then I go, oh, that is interesting. So yeah, I tend, so that will slot in where pain, proprioception, range of motion, functional movement. So that's pretty much how I build my treatment plan around those dogs. And
Okay.
yes, I do give exercises to the owners. I don't give them for the fun of it. They are targeted to help your dog regain their functional movement and strength and actually improve their quality of life. So there will sometimes be homework involved, but I do try and keep that in a way that I can try and build that into the owner's day, because I respect a lot of people are time poor. Also as well, some owners got all the time in the world, others don't. And also, doing exercises with your dog, sometimes it might not be the most fun thing you want to be doing with the dog, but it's beneficial to them. So there is homework. And then going on to sort of any advice on their home environment, maybe trying to reduce jumping up a lot, maybe trying to, sorry about the sirens, looking at the floor surface, can we put some mats down? Do we need to raise the food bowl up? Do we not need to raise the food bowl up? Where those home adaptations, because if you think the dogs who live in the human world, it wasn't ever built for them. So they are coping with things that were built for us, and we move very differently. We are bipedal, they're quadrupedal. So the way they tackle the stairs, for example, is completely different to the way we do. So it's, I don't like to be very lecturing certain things, but if the dog's struggling to go up the stairs, can we reduce the amount they go up the stairs? If you want your dog in bed with you, that's absolutely fine. I haven't got a problem with that, but can we make it so it's not having a detriment to the dog? Or do we need to stop the stairs for a certain period of time and then retrain it? Looking at all of those things as well.
Yeah. And that makes a lot of sense. I mean, even for me, I'm nodding a lot because it's making me think of one of the cases I went to see, which was a whippet. And one of the things that occurred when we were there was basically the dog, like it was like a corner settee, and the dog was actually jumping from the hallway straight onto the settee. Didn't matter if anybody was on it. Straight onto the settee, across the settee to the corner on the other side. And let's just say the owners did use some rather uncompassionate labels for this dog in what he was doing. But one thing that I then, sort of suggested to them was, well, actually the flooring you've got is laminate flooring, and this is like a skating rink. Whippets, obviously, they've got, bless them, very kind of thin legs, haven't they? And I'm not obviously clinically trained, but even I could see that even just at the hallway, you could see them sort of looking like, I don't want to do this. What's the safest route? I know what the safest route is. I'm going to jump onto the settee and walk my way around, and then I get to my spot. And I had to explain that to the owners and say exactly what you were saying. Really is it's like a skating rink. And they may have already injured themselves, obviously doing something like that to get to where they need to. So of course now they're even more hesitant to do it because they injured themselves before. And so the suggestion was, to put some carpets down, put some rugs down, or mats, or so absolutely. And I definitely, I'm so similar to you in some ways, with not obviously with the techniques I use, because I'm not a trained
Yeah,
physiotherapist, but certainly I look around the environment. So I'm looking at exactly, bed placement, where do they sleep, where's the Wi-Fi, so it's different things I'm looking for.
yeah.
But definitely it comes into it, because as you say, we need to take that into account to have that holistic approach when we're working with pets. Obviously, I'm working in a totally different way, but
Mm,
I can totally see it. And the thing is that those home adaptations, if that then means that your pet is like, oh, do you know what? I can run around the house now, it's fine.
mm.
That's going to make a big difference to how safe they feel and how happy they feel. I mean, to be honest, if I sort of try to say to people, well, just imagine that rather than carpets in your house, you had a skating rink,
Mm.
and you were actually maybe wearing roller skates on an ice skating rink, in your home. It's like you would constantly be like tensing up, you would be compensating, you'd be leaning certain ways that perhaps you wouldn't normally. You
Hmm.
would definitely be doing lots of different things to just make sure you didn't fall over or you didn't injure yourself in some way.
Mm.
Um, and even things like, if something then surprised you and you got up really quickly, you're like, oh, darn it, I've done it again. I've pulled a muscle on my shoulder or
Yeah.
whatever it was. So
Tweak that knee again, and or I've
yeah,
tweaked my back
exactly.
again, and
Yeah.
and also as well, when you're talking about that dog's running and propelling itself along, so it's relying on momentum and not muscle to actually function to be able to do that. So that relying on momentum, and as my Pilates teacher tells me all the time, momentum is not a muscle. You can do really big movements, but actually that doesn't mean you're very strong. So
Mm.
a lot of dogs that I see that are quite musculature weak, for example, will prefer to move quicker, because actually it's the momentum that's keeping them going rather than any sort of real weight bearing and getting that muscle working. So there's a lot of things that can be said for, like I said, homes and life was built for us. It wasn't built for them. So
No.
the way they tackle a problem is because they want to get up on the sofa. They want to be with you. If you will allow that, that's absolutely fine. But it's how can they do that safely? I want to, I want owners to still have what they want with their dog, as long as it's safe and appropriate and the dog's happy and it's not going to cause them a problem. Then, if you want your dog in bed, absolutely fine with me. How can we make that happen without it being detrimental to the dog? And also that can be, again, from breed as well. You look at smaller breeds compared to the size of 6-inch step, for example. So
Mm.
if you've got 6 inches of a step and you've got a dash hound who's only 9 centimeters at the withers, that's a flipping big step to get up. And that's a dog that's prone to back problems. And you're asking them to do that probably a flight of stairs, about 20 steps, I would say sometimes. So 20 steps, repetitive, a lot of the time.
Yeah.
That's parkour for me. That's hard. So can we make it twice a day? They come down in the morning and they go up at night. Can we carry them? Can we support them going up the stairs? You know, do they need to be racing up and down it? Because actually, it's quite dangerous for you having a dog running under your feet. How many people fall down the stairs because the dog's not underneath them? So it's how can we make that happen safely and, thinking about breed size and things like that as well.
Yeah. And it's a really good point, because again, I not out of neglect or anything like that, but sometimes it's
No,
just things people wouldn't even think
don't
about,
think about it
you
because,
know.
and also as well, it's the dog can do it until it can't. And this is the thing. It's like, oh, my dog can do it. It can do it at the moment. But is it doing it in a way that's causing other problems that eventually will
Mm.
lead to the fact that they can't do it? And it's then we notice because now they can't. They can't jump in the car anymore. They can't do this anymore. And actually, you go think that's because they put extra pressure on the body, because they've developed a problem. They now can't do something. And you know, rather than seeing it, we always think of they can do it and they can do it at the moment. We want to keep them being able to do certain things, but it's within a scope of is it safe for them to do them and they're not going to cause themselves an injury. I've seen some horrific videos, especially of the dash hounds, because I see it quite often. Dash hounds going up the stairs and rolls back down the stairs.
Mm.
And some people go, oh, that's quite funny. I see that's very flipping painful.
Yeah.
If you've bruised your back, and then what happens is that bruising and that inflammation will be there. And the dog might shake it off and go, all right, get up the stairs again. That's absolutely fine. But we don't know what underlying damage has been done. And then the following week, the dog will jump off the sofa, for example. And then lo and behold, you've now got a compression in the disc at the back. And we put it down to just jumping off the sofa. Not all of those times they haven't been able to do something, or all of those times they've just about been able to. So you see dogs sometimes when they're looking to jump and they have been jumping for a long time, but then one day they go, can I still make that? Can
Yeah.
I still make that jump? And immediately to me you go, why do you not feel happy to make that jump? What's going on? What's going on here? And then, was my dog fit enough to be jumping in the first place? Maybe, maybe not. It might be a acute problem that they've just developed, or it might be a more chronic build up over time. But we notice it's when those things now become they're unable to do it.
Yeah. And I know it's like makes me just think of sometimes people go, come on, you can do it. Come on, come on. And yeah, there's times when a pet won't do something perhaps because they don't feel confident or they're not sure about something. But we also need to consider that actually, maybe it's more than that. Maybe it's not a confidence thing, especially if they were doing it now, they're suddenly not.
Mm,
Maybe now something has shifted with their body and actually they know that they're not going to be able to do this, they're not going to be able to reach it. So again, it's just sort of paying attention to that, isn't it, and just noticing, okay, is
mm.
it suddenly not happening? And just obviously if your pet is getting older, or has conditions, or you just see signs where you're just like, okay, they are struggling, is don't try and, I always say to people, like, don't try and shame them for not doing it, because actually sometimes them not doing it is information in itself,
Yeah,
that
and
we need to
sometimes
work with.
we can push them and push them. Come on, you can do it. That's it. You can do it. And the dog will go, all right, I'll do it.
Yeah.
And then it hurts. And then they're like, shouldn't have done that. Sometimes they do things of their own accord. Do they know they can't run after squirrels anymore, but they see a squirrel, they go bounding outside and then they come back on three legs and you go, now that probably wasn't a good idea, but unfortunately we can't reason with it.
No.
in that respect. But it's noticing, and I say this to a lot of dogs that do a lot of sporting things like agility, for example. If your dog starts refusing to jump, and if it's just the once, then make a note of it. If it now becomes a bit of a pattern, they're refusing to jump, or the way they're jumping, or you see that hesitation, that pause, and then I do it, and something's changed, then it's actually look at, it's probably not just, but it's not behavioral. There's probably a reason why dogs want to make you happy the bulk of the time.
Yeah.
And it's looking at, actually, is there a physical reason now you can't do it? And if you can't, why can you not? Then it's how then we go from you can't do it to now how we get you functional and fitter so you now can. Sometimes it will be possible that they can do it again. Sometimes, unfortunately, it's not. That's case by case basis. But it's just having that thing of sometimes it's not. I've seen dog training programs, and I still am a dog trainer for many, many years. You see the dog that's refusing to get off the sofa, and you know, and they're pulling at the dog and they're, come on, get off the sofa. And eventually the dog starts going, get off me, leave me alone. And then lo and behold, now the dog's aggressive. When actually, when you look at the history of that dog, it's never had that problem before. It's now become like a build up of the dog now doesn't really want to move off the sofa. Well, if you're in pain and the sofa's quite comfortable, I am not really wanting to move, you know. And if no one's listening to me when they're telling me to move, that actually I kind of don't want to go back on that slippery floor because it kind of hurts me. And actually, I'm really comfortable here, and you've always let me up here. And now you're wanting me to get off. And now you're forcing me to get off. And actually, it's looking at, is it possible that there's some physical problem there? Now, there is a
Mm.
possibility it's behavioral, but the fact that it hasn't, there's been no traumatic event, there's been nothing that leads you to kind of go, well, that's solely this. Your dog's not of that, nature, for example, and you know, I've had resource guarding and things like that. That's a different ball game. But you know, one of the cases I've been working with, lovely, lovely little Shih Tzu, he was banned from the groomers when he was a puppy because he was trying to bite them. And you then go down like the patronage of how guarded this, you know, and when I went to go see him, I couldn't get, you know, so he would bite me. He would bite me. He would bite the owners. And since we've been working with him, and you know, it was then diagnosed that he had hip dysplasia, he had all manner of complications going on. And actually now we're taking the layers of pain off of him. We're now seeing that actually he's happier being touched. Now there is still limits with him. Granted, he's learned to be very guarded of himself. And, you know, there is still limits that I have to respect his boundaries until he gets better and more confident and happier. I've been teaching the owners how to do like telling them touch things with them to help them practice him being confident with them touching him, because actually in his mind he's gone, I'm sore, I have to protect myself, and now that's become a really big pattern for him. I have to bite first and ask questions about it later. And this dog doesn't want to be a bad dog.
No.
And no one wants to, you know, when if you're frightened that your dog's going to bite you, it becomes a very vicious cycle. But now we've kind of got past a lot of the pain and taken a lot of the layers off the onion with him. We're now seeing what, you know, is a bit more behavioral to what it was actually probably pain to start off with. And, you know, his grooming's now taking less amounts of time because he's happier being handled, you know, and that, you know, it's just think of, is there, you know, is there a possibility that it's a physical problem and not a behavioural one? Because your physical health affects your behaviour. I'm horrible when I'm unwell. I'm horrible when I'm in pain. But I can verbalise to my partner and I can go, look, I've got really bad headache, leave me alone. You know, turn that racket off, go away. Your dog's way of verbalizing it is to growl at you or to bite you or to say I'm completely unhappy. That is their language. So, you know, it's taken into account that your physical health will affect your behavior and vice versa as well.
100%. I mean, I worked with a dog who he was always happy for me to work with him. I did some spiral techniques with him, and one of the times that I did it, I was actually working above his neck, so I'm not even touching him, and so his neck was about here and I was about here, and I was doing that, and he growled, and instantly obviously I took my hand away and I said to the owner, oh, that's not like him, he doesn't normally do that, you know. And she said, oh no, I think that was just him kind of like, oh, I'm really enjoying that. And you know, when you kind of go, no, I don't think it was actually, I think that was a growl. So me being me, you know, I did it the way that I do it, and I just said to him in my mind, darling, I think that was a growl, I kind of disagree with your mum, and I said, if it was, I'm going to put my hand there again, I'm not going to touch you, but if that was a growl and you want me to stay away, could you do a longer growl and I will completely stop, you know. And I know not everyone's going to do it like that, but that's the way I did it. And I went to do it again, you know, and he did exactly what I asked him to do, the longer growl. And then mum turned and said, you're right, that was a growl. And I said, yeah, because I asked him to do it and I told him I would stop. And so then I said to her, right, let me just try something. So I went to the throat area because something was making me go, right, because he'd let me do it there before, no issues. So again, I just went to that area because I thought, okay, let's see how he, and again, I got the ground system right, I'm stopping completely. Well done, darling. Thank you for telling me that. And you could see him instantly just kind of go, oh, good, she's got the message, great. And I said to her, right, what's he done? I said, what's happened? I said, because he won't let me touch above the neck and he won't let me touch below the neck. So something's going on in that area. Has he done anything? Have you seen him fall off anything? And she actually said to me, you know, well, we went out for a walk this morning and he clotheslined the lead. So effectively what that is running into the lead, for those that don't know. And I said, right, you're going to the vets this afternoon. Could you just let them know that that happened? Can you let them know, obviously, what he did this morning with us? And can they check it? And when I spoke to Annette, she said, yeah, they did have a look and they said that he just got a little bit of whiplash, but he didn't need sort of any treatment and they didn't feel it was enough that he needed, I think, pain relief or, you know, anti-inflammatories or anything. But it just shows you, you know, that absolutely he was normally would allow me to do work anywhere on his body, had no issues at all. So I knew him well enough to kind of go, right, if he's suddenly going, I don't want that, there's a reason, you know.
Mm.
And then when he did that, it was like, right, so it's really obvious it's here. So
Yeah.
what have we done here? So again, it just shows people that was a really simple thing. He's out on the walk, he's close down the lead, and to us we might be like, oh, silly boy, but
Yeah.
actually to him it's like, oh gosh, yeah, that's jerked everything backwards, and
Yeah.
that hurt.
That quite
So
hurt. Yeah.
yeah,
And actually, that's now sore.
exactly. So I don't want you near it, because everything a dog, we were always taught in canine flow, everything a dog does is to feel safe. And
Mm.
the minute that actually their ability to fight or flee a situation is in any way compromised, they are instantly going to feel unsafe. And I always say to people, it's a bit like if you break your elbow and you've got it kind of in plaster, and then somebody's like, hey, do you fancy going to a concert in London? We're gonna have to take the underground and stuff, and you go on there, for that entire time, you're already feeling unsafe, because it's
Mm.
like, don't go too close to my elbow. You're going to instantly be behaving differently, and dogs and other pets, I think, are no different. Is as soon as that ability to fight or flee is compromised, our behavior changes. So
Yeah.
it just goes to show you that sometimes the smallest things that they do in those daft moments and zoomies, and like Puss, bless her, when she had a zoomie moment, she jumped across my shredder, turned it on, and although also it couldn't harm her in the way that a shredder can harm paper, that the fact that it turned on, she then leapt off it in such a degree that she ended up actually causing herself a limp, and then she had to have an anti-inflammatory. So
Yeah.
it's just those funny moments when they're having that mad moment, or having little accidents here and there, like they run into the fence in the garden or whatever
Mm.
it is, that you might kind of think, as you said, they've shaken it off, but actually maybe they haven't fully. Maybe when they did that impact created some kind of misalignment or something going on in a muscle. So
Mm.
it's always worth us paying attention to that. So just to sort of finish up, obviously, I wanted to sort of give our owners some tips. Now, I know you've already given one, which is obviously taking the videos and the photos of if your pet is struggling. And you can always ask your vet for any, condition. Would fit things like physiotherapy help? Would acupuncture help? Whatever it might be,
Yeah.
you can
Ask the
always
question.
ask your vet. The other thing, what can owners do to give their dogs a longer quality of life in general?
So, general for me, please, 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 please do not let your dog get fat. I am so that is the one thing anyone can do, is not let your pet get fat. Ultimately, with the exception of, well, horses, you still are in control of some degree, because if they're turned out in the field the whole time, then obviously they're going to eat in, to their own devices. But then that's up to you to either reduce turnout time. But I'm not a horse person. I'm not going to get into that too much. But ultimately, you're in control of the cupboard. You're in control of their food. You're in control of this. And get to know, I don't just look at weight, look at the condition your dog's in. You know, if I look at a dog and it looks round, it's not because it's muscly. Muscle has 5 pounds worth of muscle to 5 pounds worth of fat, volume wise, is completely different. And so many people go, oh, it's just muscle, or it's fur, or it's this. And you go, there's no shame in going, yes, my dog needs to lose some weight, and actually doing something about it. We as people, we use food as a thing of love. We always have done. That's the way we express love. When your dog's looking at you and going, can I have a bit of your sandwich? It's again, I don't share food. That's my food, and it's mine, just because that's me. But my partner will with my dog. And the dog also won't lie for you. If you're eating and they know they're going to get absolutely nothing, they won't come over. They will
Yeah.
go to the person who shares with them. They're not going to waste their time like that. They're not daft. And so it's then kind of looking at, what we can do to tackle that weight issue. And actually, for me, I will always be that supporting person to go, right, can we look at what we're weighing, look at the size of the bowl you're feeding? Because it's really easy when you put a lot of food in to when you put less food in, you go, oh, that doesn't look enough. And then we top it up or whatever, because we're human. That's what we do. And we go, oh, well, you know, I don't want him hungry. You know, your dog is not going to starve. You know, if your dog is not eating for a reason, there's probably something else going on. But your dog has not gotten the size it is because it won't eat something. So that's the one thing I will say. Please keep your dog on, you know, a good body condition score. It should have a waist. You should see a nice tuck of the belly. You know, when I see dogs where, especially shorter dogs, where their belly's nearly on the floor, it really shouldn't be. You know, and because things, again, because you know, we are in a bit of an obesity crisis with people, with dogs and things, it now looks normal. And actually, it's not normal, it's just common. Okay, so it's not normal at all. So that can warp our perception as to what your dog should look like to what they actually do. So that's my one big tip there.
And just before you, I was going to say, just before you continue, and I was going to say, actually, if people aren't sure, you know, what your pet should look like as a healthy individual, they can, you know, a lot of vet surgeries will do like weight clinics, or, you know, nurses will give advice. I've known that happen before, where they'll, you know, have you in and get your pet weighed, whether that's a cat or a dog. I know some clinics actually, I've definitely seen photos in the clinic of ones for a cat, for instance, of what's obese, what's overweight, what's a healthy, what's underweight. So they're going to have it for dogs as well. So
yeah, you're going to have a, if you, even if you Google body condition score and then just look at the shape, you know, because obviously you've got mixed breeds. So sometimes
yeah,
it's very hard to, you know, if you've got like a, I don't know, bull mastiff mixed with, I don't know, a Staffordshire Bull Terrier, for example. There's a big weight difference between a Bull Mastiff and a Staffy. So their weight and their size will be very different to what a Bull Mastiff is to what a Staffy is. So it's shape. It's look at your dog's shape. And I always kind of go, if you take your hand here, I don't know whether you can see that really well. If I run my fingers across here, and if you think that that's your ribs, so if you're
yeah,
feeling along your ribs like you are your fingers, if I can count them like that, that's probably a bit too skinny. If I go to this part of my hand and I feel here, I've got a bit of coverage, but I can feel the
yeah,
bone quite easily under my fingers. That that's good. Okay. If I go to up here where I'm getting all that wobble here, your dog's probably slightly on the overweight side. If you can't
okay,
feel your dog's ribs at all, then your dog's probably slightly on the overweight side. So that is,
yeah,
you know, you can do that. Just feel over your dog, feel them over, because actually, again, you'll start to get to know your dog's body, and you might decide that actually one leg's bigger than the other, and it's, you know, muscle tension is, you know, different because it feels different. But when you're feeling your dog over, if you cannot count your dog's ribs comfortably, then I would say they probably stand to lose a little bit of weight. I think there was a study that said even 10% weight loss in dogs that are overweight has a real massive effect
mm,
on their overall health and well-being. So, and especially recovery as well from MSK
yeah,
problems, risk of developing them as well. So being overweight is, you know, please keep your dogs, you know,
or any pet
any pet, you know, just
at a
make sure they're
healthy weight. Yeah.
healthy
Yeah,
weight.
we had to do it with Puss, to be fair. So,
Yeah.
you know, when the charity that took her on, when they took her on, she was actually, I think they said to me that she was weighing in at 7 kilos, which is a lot for a cat. You know, most adult cats are around kind of the 5 mark. And so they'd already got her on a reduction diet.
Mm,
And when she came here again, for the whole time I've had her, I've weighed out her food every morning, you know,
mm,
for a certain percentage. And also when obviously got to winter time, she's not going out as much, she's not maybe as active. Again, I did just reduce it just slightly more, just because I could see over the years that I had her that actually when we came to kind of springtime, she just put on just a tiny bit, not much, because by the time, as I say, you know, she came to me, she was already weighing in at about 5'3", so they massively got her down to a much better weight. But because of obviously the cruise issue, and obviously then everything else that has materialized, it was important, exactly as you say, it was important for her to be at a healthier weight. And so that was something that I always did, and I always kept an eye on. And you know, I would always consult with the vet, and then we actually changed her food because she often was quite ravenous, and everything was checked. There was no other conditions that was creating that, and they just felt that actually what had probably happened was when there were circumstances prior to the charity even taking her on, it was kind of now a habit to just stuff down my food. So we then had to provide her with a food that is called like satiety. So it effectively made them feel satiated for longer, such that they then weren't going back and stuffing their face even more, sort of thing. So again, there's, you know, various things people can do. But yeah, absolutely, you know, we did that because I knew otherwise obviously it would cause her an even bigger problem if obviously she was obviously a much heavier weight. Because if I'd left her to her own devices, 100% she would just ate through the bowl of food and said, right, where's the next lot coming from? You know, somebody had suggested that to me to start with, was actually you know, to fill the bowl, and she'd only do it once, and I didn't fill the bowl because I knew her even then well enough to know, no, she's going to stuff down the lot and then ask for more. So, you know, so there are, you know, definitely I agree with you, you know, weight management is an important thing, especially if they've already got conditions, which obviously, you know, as it turns out, she did already have. But sadly, the vets that she went to prior to the charity even taking her on had a fire, so all of her records were completely gone, because it was paper. So it was a bit gutting, because bless them, they're kind of taking on a blank canvas, sort of thing. So okay, so that was your first tip.
And also just to go back to your point about that variability in like winter to summer and whatever else, if I have a more active day, I can probably stand to ingest more calories. If you don't have a very active day, then you probably stand to lose less. So actually feeding your dog on a little bit of a variable scale like that can sometimes be quite helpful. But also if your dog's had a surgery and you're still feeding them the same amount of when they were running around, and now they can't because actually they're on restricted exercise, reduce your food down as well. So really make sure, because that's often a bit of a tip that you never get from the vets. And normally they go, oh, they're putting on a bit of weight. I'm like, okay, we need to reduce that food back down because they're still on normal levels for an activity they're now not doing. So you know, you look at sportsmen that can sit there and gorge themselves on 12,000 calories a day. Well, you look at the effort they're using to expel that. You know, I can't eat 12,000 calories a day. I know what size I'll be. So it's you know, so that's a very good one. Looking at your home environment as well, just seeing, is your dog struggling with certain things? Can you change it a little bit? And you know, is there things you can do now? You know, can you put rugs down for them where if they like to get up on the sofa and you have laminate flooring, can you put a rug down near the sofa so they've got some traction when they're lifting and coming down? You know, does your dog need to run up and down the stairs? You know, can you do it in a more controlled way? You know, those sort of things. Just have a look at how your dog is in general. Just start to notice, is there things that are struggling? Can we change it? Can we make it better? You know, and so those are like the two main things I would really go into without, you know, starting from puppyhood all the way up. You know, those are your two main things that if you want to do something right here, right now, look at what you're feeding, how much you're feeding, how your dog is right now, and look at, is there anything they're struggling with? That's what you can do this evening. If when you're watching the telly, you can give them a good feel over. And actually, you might be surprised. You might find, you know, you might find lumps that you haven't actually noticed before. You might find other things, you know, that actually is completely unrelated to what we've been talking about, but actually, you know, you will discover things. You might even find just a tick, in which case you know what to do, get that off. So yeah, getting to know your dog, really start to notice, are they struggling, and what you can do with their weight. Those are my two main tips you can go away and do right now.
Okay, that's fantastic, thank you. And I know something else that we talked about, because we've talked a lot today about certain conditions, and you know, both of us have been in the veterinary industry as such, so there's a certain level of that I can understand. Is also, if you know, if when you go to the vets, they're probably going to do the same. They're going to talk to you in veterinary language because that's what they do. It's the same as me when I speak to people. Sometimes I use therapist language and I have to go backtrack, layman's terms, what, you know, how would I say it normally, kind of thing. Is always ask your vet, what do you mean, you know, or what does that diagnosis mean, what does that symptom mean, you know, so that you can get a better understanding of what's required, isn't it?
Yeah, and don't be frightened to just say, can you make it in simplest possible layman terms for me? Because even when sometimes you ask them to explain something, they will still go in vet talk language.
Yeah.
And, you know, and I always ask people, I go, did they explain to you what hip dysplasia is? Did they explain to you what CCL rupture is? You know, because often people don't know. They just go, oh, it's a ligament in the knee. And I go, okay, so this is what it calls. This is how basically your knee is. And when that goes, that moves forward and it shouldn't move forward. And that moves inside and that shouldn't do that. Or this doesn't fit in there properly. And that's in the most basic layman's terms I can put it in, is that doesn't fit there properly. So this is what happens. And now we've got a problem. And also it's just say to them in the most, you know, dumb it down for me. If you're really,
Mm.
if don't be frightened, you know, I have to switch from vet talk to layman's terms, you know, all the time. And even sometimes when I'm talking to the vet, if they're explaining it to me quite quickly, and I'm there going, right, so hold on a minute. What have we said here? Blah blah blah. Whereabouts that? And also sometimes they might not give you the full information. Well, for me anyway, they'll go, well, dog's got, I don't know, spondylosis. I'm going, yes, and what vertebrae? Where are we at with this? Because that will affect how I treat. And sometimes I have to go back and go, I need more detail on this.
Yeah.
So don't ever be frightened to just go, can you make it in as layman's terms as possible?
Yeah.
Or if you need more detail, ask for more detail, you know, ask
Yeah.
them about things. You know, don't ever feel that you have like some white coat. You know, we often think people in authority, we go, oh my God, I can't ask the question. Ask it. And actually, it's helpful for the vets as well, because they get into the habit of explaining things.
Yeah,
So then you
exactly.
don't have to ask, because if no one asks them, you know, they get out of the habit of explaining it. And actually, sometimes talking in that layman's terms, they're around veterinary staff all day.
Yeah.
And you know, and going from talking to the vet nurses to talking to the receptionist, it can be sometimes you just get stuck in a way of talking. It's not because they're consciously, you know, they're not trying to make you feel stupid.
No.
It's just say to them, can you put that in layman's terms for me? And then it will let them stop and think of actually, and actually how they can, you know, improve their dealing with their customers
Yeah,
ultimately.
the
Because
communication.
yeah,
Yeah.
exactly. If they get into a habit of it, and you know, and if you're, even if you've got medication and you're not sure, ask them. You know, you can get different. You know, if you're giving your dog a lot of tablets and a lot of medication, the same with yourself, it's quite hard to, you know, do that. You can get little pill diaries and things like that, and that you can fill out, and you know, just little things like that that can just make your life a lot easier. And actually, the vets then get into a habit of being able to give that information, so then you don't have to ask for
Yeah.
it.
And also
You know,
things like, you know, not even, well, you know, what does it actually mean that they're saying to you, as you say, in like basic terms, but also what does that mean for my pet? You know,
yeah,
if somebody says to you, you know, they've got hip dysplasia, okay, so what does that mean for my pet? You know,
yeah,
because actually otherwise you kind of like, oh right, okay, you know, and actually it might be that we need to, you know, depending on the severity of it, maybe there might have to be changes in lifestyles or, you know, things like that. Do you know what I mean, isn't it? It's like the more
yeah,
questions you ask, the information that you glean from that, the better you'll be able to help your pet. I
yeah.
mean, it does
And
make a big difference.
exactly, and ask them about how can you manage the condition effectively. If your dog's, you know, let's say got hip dysplasia, how can I manage it well? So they, you know, a lot of the time they'll go, oh, well, they don't need surgery yet, and maybe they won't need surgery in future. Okay, that's great, that's cool.
Yeah,
How do I then not make them need surgery? You know, how can I maintain this? You know, what is out there that I can do? Because if you say, I mean, sometimes, you know, owners have said, you know, they would like physio, and the vets go, oh, you know, that might not be applicable for them. And that can vary between vets of what their belief system is, what they know about physiotherapy. That's a whole nother thing of, you know, them actually knowing what we do
yeah,
is quite hard, because some do, some don't.
yeah,
You know, that they've got, you know, they've got a lot on, so I, you know, I don't know about certain things that they do, if I'm honest. You know, I only know about the musculoskeletal stuff. In terms of cardiac, I have no idea. Well, I do to some degree, but you know what I mean.
yeah,
There is, you know, it's saying to them, you know, would it be beneficial? Because there's certain conditions they might not even think require physiotherapy. One of my first patients had meningeal encephalitis, so it's swelling on the brain. Now, ultimately, I wasn't treating the brain swelling. I was treating everything that come because of that brain swelling. So the proprioception delay, the muscle atrophy, all of that is what I was treating. I wasn't treating the swelling on the brain. So they may not even think that that condition requires physiotherapy. So it might be, if you think it's of benefit to your dog, speak to the physiotherapist. We can then liaise with the vet and say, look, this is what I want to do. We send over our forms and go, this is what I want to do. And we can give them an outline of what we will be doing. And actually, sometimes that changes how the vets see what we do. And actually, sometimes dogs that we can help, that the vet may not even think physiotherapy will help, because actually they may not know about it as much, or they've never encountered it. I wrote a blog about the dog that I rehabbed for meningeal encephalitis. I've had emails from Canada about people asking me about it. And you just go, there is things you can do. Ultimately, I was never treating the swelling on the brain. That was for the medication to do, and
Yeah.
that was the vets overseeing things. And when it
Yeah.
got to a point of maintenance, there was a certain treatment I wanted to use, and I had to just make sure the vet was happy that I could do it, and the manufacturer of what I was using was happy. And then I liaised with them, and they, and then I got the, yeah, you can use it. Obviously, if something goes awry, stop using it. And I was like, that's fine. I've got your blessing.
Backing. Yeah.
There was a reason why I thought, could it be a contraindication, could it not? But I thought I'd rather check with the neurologist, and I'll check with the manufacturer and go, this is what I think, what do you think? Because if the vet told me no, I don't think it's safe, I can't use it.
Yeah.
But I had to clear that with them first. And actually, again, that's still me keeping that vet in the loop of what I'm doing. And actually, this dog's now back competing, that we thought was never going to happen. So it's sometimes the vets don't know what we do. So it's always worth asking, or speak to a physio. If you think it can benefit, we can then speak to the vet. If the vet's a bit reluctant, we can talk to them. But
Yeah.
ultimately, they do have the say so. But we can speak to them and go, look, this is what my plan is. And then the more they understand, the more they're happy for things going forward. And they might go, well, we want weekly updates, we want this. And that's absolutely fine. I'd rather work with them and reassure them that ultimately what I'm doing,
Yeah.
it's
It's causing no
not going to,
harm.
yeah, exactly. So just always ask the question, speak to the people. If you have any inkling that, is this therapy right for my dog? And also find the right therapist for your dog. Have a look at the qualification. There's massage therapists. They work I use massage as a modality. That is what they use, can be what they use solely. I don't delve into what they use, but it's a
Yeah.
modality that I use. Different people use different modalities and things, and ultimately the way I see it is we're all body workers. We're working for the same cause, to get your dog fit and functional. So that, again, another story for another day of why I
Yeah.
think be more integrated. But it's, check their qualifications if you're unsure. I've got a degree, a 3-year degree, bachelor's degree in veterinary physiotherapy. There are different associations out there, some, that have, there's not just one. So don't be just put off if they're not part of this one, they're not part of that. There is multiple. And actually some people are not part of any association. That doesn't take away from what they can do. And
Yeah.
also go with your gut. If you gel with that person, they're working well with your dog, and sometimes, you can have a physio that's, or whoever, that's qualified completely and whatever, but you just don't gel with them, and they don't gel with the dog that well. That's absolutely fine. Then they're not the right
Mm.
person for you, and
Yeah.
that's okay, and
Yeah,
that's
but we
not
don't get on with everybody, do we? There'll be certain, I mean, you think about
exactly.
doctors, most people will turn around and say, I don't like seeing that doctor. I always see that one,
Yeah, I prefer to see that one if I could.
Yeah,
I'll do that one at a push if it's really
that,
urgent. Because ultimately, if you don't like the way someone's explaining it to you or things like that, then
yeah,
you're
or
not going
being
to
with
take
you.
it. Exactly. I want people to get value from what I'm giving. And also the more I get the owners on board with what I'm doing, the better result I get.
Yeah,
Ultimately, my strap line is healing in partnership, because it's a team effort. What rehab I done with the dog with meningeal encephalitis, if the owner didn't do their homework, we wouldn't be where we are now. You know, it's a team effort ultimately at the end of the day. It's not just me. You know, you might see me once a week, twice a week, whatever.
Mm.
What you do in between those sessions is also going to make a difference.
Yeah. And I think the thing is that certainly from the work that I do, like if and I always said it with posts, is if an owner doesn't resonate with you for whatever reason, the pet is going to feel that big time.
Of
You know,
course.
I mean, you know, people might laugh, but I always used to say, like, I knew puss well enough to kind of gauge what answer I might get. But whenever we used to have to go and see a vet, I used to say to her, what did you think of that vet? How did you feel about being
Mm.
with them? You know, because some of them she'd be like, no, they're too loud. I can't, I don't want another consult. They're too loud. You know, I had one gentleman, he was a lovely gentleman, and he literally got her out of the carrier, scooped her up into his arms, you know, and was cuddling. And I was like she never really liked being cuddled, but of course now we know about all of the conditions that he shared. Well, you
Yeah.
know, no
I
surprise.
wonder.
And I asked her afterwards because I was like, you know, she didn't let anyone else do that at all. And I said, you know, how did you feel about him doing that? She was like, yeah, he was really nice actually, he had really gentle energy, you know. And I was like, oh, okay. But it was, you know, and yes, okay, I'm lucky I have the ability to ask that.
Mm.
But if there'd been a vet that again that I didn't really get on with, and I was like, no, I'm just not liking the way you're working with her or dealing with her, she would massively pick up on that.
Mm.
100%, you know. So for me it worked both ways. I'd always ask her, but also likewise she'd also know if I wasn't quite gelling with a vet as well.
Mm.
And the same with my other cat. Didn't know that at the time, but definitely you could tell if I didn't like somebody, 100% she would you know, respond to that.
Mm.
So that's the thing is you know, and it's going to have the same thing. If you're going for a vet, you're working with a vet physio that you don't get on with, your pet is also going to be mimicking that. They're going to show that you're not quite getting on with them.
Yeah.
And it kind of brings us on then to the kind of the contact information. So as you said, you know, qualifications obviously is a big thing to look for. People can ask their vet, do you know any veterinary physiotherapists?
They
Obviously they
can
may
do, yeah.
well do,
So
but they,
yes, some can be a bit reluctant to refer directly because there's a certain liability on things,
yeah,
you know.
yeah,
But
I
sometimes they
understand that.
go, "Oh, well, I know someone in the area, or Google someone in the area, or blah 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 blah."
Yeah,
You know, and also because I've moved to a new area, some people don't necessarily know who I am a little bit, and there is all of that as well. So, you know, have a look, see, you know, speak to a few people if you want to. You know, I've never got an issue with anyone doing that. Speak
no,
to, you know,
exactly.
and I often, you know, I refer to dogs to hydro, I refer to see chiropractor if I think it's necessary. You know, I will always say, you know, I think the dog can benefit from XYZ. I've got no issue with that. We're all working to the same thing. And actually, you
100%.
know, so the hydrotherapists that I work with, especially for the little Shih Tzu, I referred to someone I knew very well just because I knew his temperament and I knew she'd work with him. And okay, she may not be the closest to them, but she's good and she takes her time. And actually, he really likes her. So actually, that's a bonus. And you know, it's also having that rapport because I will message her and go, I've seen this, you know, this I want to tackle X, Y, and Z. This isn't developing the way I would want it to. They completely agree and go, what can you do in the pool that I can't do out here? And
Yeah,
actually, what can I do out here that's going to help you here? And how can we build that plan together? You know, it's not about, for me, it's never about, you know, seeing any sort of competition in things. We're all working for the same outcome ultimately, and that's what how I work. But yeah, some people work like that, some people don't. But
mm,
you know, always just have a look around, speak to people. If you get a good vibe off of people, you see how they work. Dogs happy. Obviously, I have dogs that are more anxious than others, so it that can be a thing. Some dogs are happier being handled, others not. You know, and it's just, you know, so ultimately, it's just going. Do you like them? Are they working professionally? And you know, how do you feel about them? I have dogs that relax completely into my sessions. I have dogs that are highly anxious all of the time and they don't relax in any respect. But I put them at ease and work with them in, you know, work with
exactly.
their remit. It's just
Yeah,
you get people that when they're being massaged and things, they just can't turn off, and that, you know,
yeah,
their brain just doesn't. So there's always that element going on as well. So you know, just go, speak to people, ask, and if they're open and about what they do, then that's the key thing there.
Yeah, I mean, I do the same. I've had people ring me for therapy, and I will say to them, have you spoken to other people? And they're like, well, I have, yeah, and I don't really know who to go with. And I always say to them, go with who you resonate with at this moment in time, because
Yeah,
they'll be the ones that actually are right for you at this moment in time. And it might be down the line that you kind of go, okay, actually, I've come to an end with that, and I might go to someone else. So it is a similar thing, absolutely. Is speak to a few. I've certainly said, Google. Like, if I did it earlier just to make sure it worked, if you type in, veterinary physiotherapist near me, or near or in Kent or in Essex or
yeah,
wherever you are, you're going to start having listings coming up. And
yeah,
then, as you say, you can give them a ring, you can even speak, you can speak to your vet. So I found this veterinary physiotherapist. Have you ever heard of them before? And they might not have done, and that's okay. It doesn't mean there's
yeah,
any issue with that. But as you say, just give them a call, and again, you, as you say, you'll know from the way they're working with your pet, like if as you say, you're understanding about that pet's anxiety, and you know where the kind of the limits are, and you're working with that rather than doing anything like forcing them or whatever.
mm,
Then to me, it's like, then that person is working ethically with your pet, with your dog.
mm,
So just a couple of tips there: if people want to find a veterinary physiotherapist, speak to your vets. Google veterinary physiotherapist near me or in your particular county or town. And obviously, again, you can look at the qualifications that somebody might look for. And as Charlotte said, they're not necessarily going to be part of a particular association. But obviously they're going to have qualifications to do what they do. So look for the qualifications. So last but not least, obviously, if somebody wanted to get in touch with you because they've been liking what they've been hearing today, would you like to share with them your contact details? So maybe your website, your email,
yeah.
telephone number, if you wish.
So my website is www.leadthewayphysio.co.uk. So that's my website. You can have a little browse around, see what modalities I offer, things like that. My email address is charlotte@leadthewayphysio.co.uk. I have got two studies on PMF therapy at the moment, if for dogs with osteoarthritis and hip dysplasia. If you want to know more about that, please give me a call or drop me an email. Actually, is probably better on that one, because then I can send you over some details and as to where those studies are being conducted at the moment. And
Is that for you
also,
wanting participants? Is
I
that what you
do,
mean? Right.
yes,
Okay.
yes, I do
Okay.
want participants. And for the study conditions, there's certain things I require. But yeah, but I can get into that with individual people. Otherwise I'll be here all day. And basically my telephone number is 07592 209 198. Even if you're not in my area and you've got a question, I will always get back to you. It might not be today, it might not be within the hour, but I will do my absolute best to respond. And yeah, so if you've got any questions, please feel free to ask. I don't mind talking to anyone. I have people,
Oh,
I've had people from Canada message me about that particular condition. So,
yeah.
and I'm always happy to answer questions to the best of my knowledge. Obviously I don't know the Canadian system, but to the best of my knowledge, I will answer and say.
Okay. Oh, that's lovely. Thank you for that. That's really nice of you to do that. So, well, thank you. It's been an absolute, as I said earlier, really an absolute delight to interview
Been a
you.
pleasure. Thank you.
So much more we can talk about, but we'll maybe
We'll
organise some
park
podcasts
in,
down the
yeah,
line. Yes,
get some more
exactly.
specifics. And actually, if anyone watching has any topics you actually specifically want to talk about, I'm sure me and Victoria can have a really good look at that and see
Yeah.
what we can do.
Yeah. Okay. I'm sure we can, definitely. So yeah, people can just let us know. So thank you very much. Appreciate your time. And
Thank
for those
you.
that are listening, if you like what you heard, then feel free to kind of subscribe to this channel on YouTube, so you get updates of obviously when podcast episodes are coming out. And that's probably about it, really. Feel free to obviously add a comment or add a review on Facebook, Instagram, LinkedIn. I'll be sharing it all on there. So if you've got a takeaway from this session that you've been listening to, then feel free to share that with us. Or if you've got any questions, likewise, you can do that. And I can always obviously then just pass it on to Charlotte and put you both in touch. So thank you to everyone that's been watching or listening. We appreciate you. Without obviously you, there couldn't be this podcast really anyway as well. So thank you you to Charlotte once again for your time and your energy and your knowledge, and we'll say goodbye for now.
Thank you. Bye.